Good evening to one and all present here. I'm really happy to speak to you on functional foods, the benefits, concerns, and challenges. I really thank the organizers for having given me this opportunity. So, the term functional foods was first introduced in Japan in the mid 1980s, and they referred to foods containing ingredients which aided specific bodily functions in addition to the nutrients that they had. And they actually gave the term foshu, that is foods for specified health use. Later in 1994 we had functional foods which were officially defined as any modified food or food ingredient that may provide a health benefit beyond the traditional nutrients it contains. Amongst the early developed functional foods were fortified with vitamins and minerals. Subsequently, they fortified it with other micronutrients like omega 3, phytosterol, and even soluble fiber. Food companies have been developing food products with multiple benefits in a single food. And this research still continues, and it is a market to look for. So, there are so many terms associated with functional foods. Let's go through them. You have bioactive compounds. Those are the natural chemical compounds which are either derived from plant sources, animal sources, or marine sources, which offer a desired health and wellness benefit. Then you have dietary supplements, which we've always been having. Those have supplemented our diets. You have iron supplements, you have calcium supplements. Those have always supplemented the food that we eat, but they do not replace our meal. Coming to functional ingredients, they are standardized, characterized bioactive preparations, but they are called as functional ingredients as a separate thing from bioactive because they vary in their purity. So when they are extracted, they are going to be varying in their purity. You have medical foods, which of course can be administered under the supervision of a physician, but they are entirely intended for management of a disease or condition. Then you have natural health products, which includes herbal, Ayurvedic medicines, homeopathic preparations, traditional medicines, jadi buti, which probably doesn't even come under a Ayurvedic thing, maybe there, but we don't know. So these are products which are available as medicines or dosage. They diagnose, they treat, and they prevent disease, and they may also restore or correct a body function. Natural health products may also include nutraceuticals, which we know today. Now, when I come to functional foods per se, I'm going to talk about two types of functional foods. There are industrial products and there are naturally occurring ones. Industrial products, symbiotics and nutraceuticals, I will cover slightly lesser. My focus is going to be on the naturally occurring functional foods that we know, coming to us in a wide variety of foods. So, what are symbiotics? To know symbiotics, we talk of probiotics, which are live microorganisms that offer benefit to the health of the host when they are given in small amounts. Prebiotics are selectively fermented ingredients which cause positive changes in the gut microflora, and they too confer benefits to the host. Now, symbiotic is when probiotics and prebiotics are administered together, and there are many industrial products which are symbiotics, and they offer benefit to the host. They improve the GI tract and give the other benefits which are listed for it. Nutraceuticals, many a times called as designer foods, phytochemicals, functional foods, nutritional supplements. Today, we know they exist as fortified breakfast cereals, herbal remedies, and bio yogurts, etc. This global market of nutraceuticals is expected to reach $57.5 billion by 2025. And believe me, when I said earlier that this is a market to look for, this is something which is definitely only going to increase but never stop at any research. Now, coming to the evidence of functional food benefits, okay, which are the functional foods we are going to do, but what are the food benefits that they offer? You have plant sterol and stenol esters, and the evidence for this in research is very strong. they have advised 1.3 grams per day for sterols and 1.7 grams per day for stanols. You have soluble fiber. Again, strength of evidence very strong. Advised to take 1 gram per day. You have beta glucan, 3 grams per day. All these are health claims of these bioactive components. And yes, very, very strong evidence. What I've done is in this table, I have put very strong, then strong, weak, and weak to moderate, weak to moderate, and weak. So we know now that these are the ones which are sure shot as functional foods to be included in the diet as much as possible. Same goes with fatty fish, known for their omega-3 fatty acids. Taking two oily fish or two sources of omega-3 fatty acids per week, those give you a strong benefit. And omega-3 fatty acid oil is also a addition for dietary supplements. So that itself can also complement something else after it is added. Coming to proanthocyanidins, the evidence is moderate, but you need to take 300 ml per day. And it's a conventional food which is not for Indians. If you say what I'm saying, we do not talk of cranberry juice 300 ml per day. Garlic. Organosulfur compounds also have a moderate evidence, 600 to 900 milligrams per day, again to be used as a conventional food or supplement. This probably is not very difficult for us because we do cook with garlic. And you can, if your food is not having garlic, then you may make it a supplement, or rather you may make an effort to put it as a supplement in your diet. Coming to green tea, such a debatable issue. We can have an entire webinar on green tea. So you have catechins which have weak to moderate strength of evidence. And there is no recommended amount given. It is really unknown. And it is to be taken as a conventional food. Now, what I want to tell you over here is, why does this happen? When we are doing any research and we want to test a certain food, we need to give it in a certain quantity and increase the quantity and reduce something else. When we are doing any research on green tea, you have too many confounding variables because of which we are unable to reach a proper conclusion. That doesn't mean that we skip green tea, but that also doesn't mean that we have green tea as 8-9 cups thinking I'm getting the best benefit to lose weight. So we have to be very cautious that we don't know how much to take. Taking 1 or 2 cups is good because it is going to give us antioxidants. Then lutein and zeaxanthin, again weak to moderate, take 6 milligrams per day. Similar thing like any vegetable, use it as a conventional method. Dietary supplement, you really don't need to use it if you're going to eat your greens, as they say. Then tomatoes, having lycopene, weak to moderate. Again, the reason I will tell you over here, tomato probably makes up a component of many foods. So if you're making a vegetable, you put 1 tomato. You're making, except for tomato soup and a particular tomato gravy, the tomato is only one small addition to it. And therefore, it is always going to be difficult to identify exactly how much of it you will take. It's better to stick to it like a conventional food and continue having it. However, consuming it daily is going to give benefits. So we should take our tomato without really going over the board for the lycopene that it contains. Now, coming to conjugated linoleic acid, same problems, same justification, and the strength of evidence weak. Secondly, this is not where we have no Indian studies to do with any of these. So we don't talk about it. It's a conventional food. Whoever is a non-vegetarian can include it in their diet. Glucosinolates, indoles, have 3 or more servings per week. Keep it as a conventional food. Do not make it a supplement. And whatever little benefit you're going to get from it, take the benefits, because the benefits are sure, even if it is a weak evidence. Probiotics. Surprising, this thing says weak strength of evidence. It is should be taken daily. Now, why is it weak over here? because here they are talking of taking probiotics in the food form, whereas today you get probiotic supplements. If you take probiotic, one probiotic, you're going to get enough. And so take it daily. We are not giving you an amount which should be taken or should not be taken. Try to keep conventional food which is also going to be probiotic, and use the supplement. Now when we say supplement today, probiotic drinks, so many of them can be picked up off the shelf and taken, and those definitely offer benefits. Just make it a habit to have it as often as you can daily. Now, so when we have said over a period of years, we've been knowing medicine, we're knowing, today the interest in food has increased. Today, dietetics is getting the due respect that it is there for, and still it needs more. But the relationship between diet and health has increased considerably, and functional foods offer a wide spectrum of benefits. I don't want to read out any of these. What I want to tell you over here is, while we have things like promoting growth and development, and you have something like maybe improving for beauty, they are used. But look at the benefits when it comes to memory improvement, oxygen deficit tolerance, radiation protection, anti mutation, anti tumor, vision improvement, sleep improvement. All of us, if we look at it, we will identify something over here that I need to take my functional food because of this. Now, why I don't want you to focus on body weight reduction, body lipid regulation, and body glucose regulation is because, like Dr. Prerna very clearly said, exercise. So, body weight reduction doesn't mean take functional food and you will start losing weight. Take so many cups of green tea and you will lose weight. What she said is right. Get active, start moving, and make an effort. All the functional foods will help you in all these things when you are making an effort in some other way as well. Another example, blood glucose regulation. A diabetic cannot say that I am taking my functional foods. So, what if I have sugar all the time? Or suppose I can skip my medication. It doesn't work like that. Functional foods are support which is with these factors, and they should be used as support and not as replacement for food or for any medicine. Now let us look at some of them. What are they doing? Beta carotene and lycopene. They neutralize free radicals which damage the cell. They contribute to prostate health. Flavonoids and isocyanates neutralize free radicals and strengthen antioxidant defenses, and are help for detoxification of undesirable compounds. Lutein and zeaxanthin contribute to maintenance of healthy vision. Soluble fiber, insoluble and soluble, they help in maintaining the digestive tract, reduce the risk of CHD and even some type of cancers. Beta glucan whole grains are responsible for reducing the risk of CHD and maintaining blood glucose levels. Organosulfur compounds also reduce cholesterol and LDL. Omega-3 fatty acids reduce the risk of CHD and maintain mental and visual function. Minerals reduce the risk of high blood pressure and stroke and maintain a healthy vision, immune function, and bone health. Probiotics have been established for good gastrointestinal health. Now I'm coming to certain foods which are um, functional foods, but how do you take them, and some salient points which we can remember. So dry beans and legumes are cheaper and can be healthy additions to the diet. Secondly, cooked beans are nutritious and they promote digestive health and relieve constipation. Beans contain health promoting compounds, saponins. Saponins have the ability to protect against cancers, lower cholesterol, and lower blood glucose. Berries. Now, I am actually, and this is not for the presentation, but I'm telling you, I love the Indian berries. You come a season and you'll find that I'm buying the berries, and even if my family says no, I'm still be eating my berries. So, though we talk of blueberries and cranberries and all that, look at the Indian varieties. Look at amla, look at jamun, look at the small bear, the bigger bear, the small bear, even the raspberry. Everything is loaded with nutrients. They have the highest antioxidant levels compared to any fresh food. They have phytochemicals that reduce cancer rates and other chronic diseases. We know that jamun lowers blood glucose and amla builds immunity. But this is only two. The same things are offered by every other Indian berry, and we should make it a habit to consume them when they are in season. Antioxidants, ellagic acid and quercetin also have anti-cancer activities and the ability to suppress progression and proliferation of tumors. These two acids are present in strawberries. Strawberries are there for us when we get them in the season. If you're getting them at a good price, affordable, you can include them in your diet. Cruciferous vegetables, cabbage, broccoli, and Brussels sprouts, they have health benefits because of their high content of glucosinolates. These have been associated with reduced risk of lung, stomach, colon, and rectum cancer. Chocolate, the something which is a confectionery item rather than a medicine. Well, cocoa powder and its extracts have shown antioxidant capacity. These enhance vascular function and decrease platelet stickiness, positively influence the cardiovascular system. Research has supported the suggestion that consumption of flavanol-rich cocoa and dark chocolate may be associated with a reduced risk of vascular disease. Citrus fruits contain phytochemicals called flavonoids. Hesperidin is an anti-inflammatory agent. It blocks an enzyme involved in inflammatory reaction of release of histamine. Some of the flavonoids in tangerine and orange are potent cancer-fighting compounds and also particularly the lung and prostate cancers. Loaded with potent antioxidants, these fruits are able to suppress cancers and inflammation due to reactive oxygen species. Just give me a minute. Coming to pumpkin, see, when I say functional foods, I am not really going to talk about each and everything, but a few select. Pumpkin is loaded with antioxidants, beta carotene, and it offers protection from development of cancer and cardiovascular disease. The pumpkin seeds are sources of omega-3 and alpha linoleic acid. Mind you, today this is known, and so people are taking pumpkin seeds, are offering. But remember one thing, that if they are not properly dried and slightly roasted, they get rancid very fast. So be careful when you're taking pumpkin seeds. Research supports the beneficial effects of alpha linoleic acid in the prevention of CVD. Spinach is also a very important antioxidant vegetable, and we frequently eat it. It is one of those most agreeable leafy vegetables in our diets. So they have flavonoids and polyphenolic active compounds. They combine all these compounds, work with each other as anti-inflammatory, antioxidative, and anti-cancer agents. Sweet potatoes, low in sodium, good amount of fiber, and of course has other vitamins and minerals, are good sources of beta carotene and likely to reduce certain cancers. Tomato, lycopene, which is responsible for its deep red color. Consumption of tomatoes and tomato products are associated with decreased risk of prostate cancer and CVD. Tomato processing may increase the bioavailability of lycopene. And actually speaking, if you read research studies, they talk of using tomato paste, which is probably going to give more benefits than whole tomatoes. So the reason is because after processing, the trans form of lycopene converts to cis form, which is easier to absorb. Also, the tomato paste will be a concentrated paste with lycopene compared to one or two large tomatoes. Coming to fish, most significant source of omega-3 fatty acid consists both EPA and DHA. It is a good source of protein, low in saturated fat. Mackerel, trout, herring, sardines, tuna, and salmon are good sources of omega-3 fatty acids. Sorry, I think I've made a spelling mistake there. Then it is suggested, like I said before, 2 fish per week. Well, it can reduce the cardiac death incidence by 50%. It has also shown positive effects or positive help to patients of rheumatoid arthritis, where there is reduced number of stiff joints and duration of morning stiffness and pain. Soya proteins and soya bean, very, very important. A daily intake of 25 grams of soya protein is recommended. Soya has phytoestrogens called isoflavones. They help prevent prostate cancer. They are good for bone health. They are a powerhouse of phytochemicals, prevent CVD, are anti-carcinogenic and hypercholesterolemic compounds. Soya is also said to have a non-isoflavone biological active compound, which also is associated with cholesterol lowering effect, blood pressure lowering effect, reduced cancer risk, and favorable effects on kidney function. But there is a but over here. Soya, talking of taking 25 grams of soya is not going to be very easy and not very right if you don't take care about it. Now, soya also contains trypsin inhibitor, which affects the bioavailability of essential compounds. Soaking, pressure cooking, cooking at high temperatures, that is boiling a lot, is advised. Roasting can also be done, but remember that simply slightly roasting soya and they're going ahead to cook it, and once it is just cooked, stop cooking, may not make all the functional ingredients available to you. So make an effort to cook soya in the right manner. Now, because soya has this problem, and because we know that soya is not so very easily digestible, several processed foods are available. You have yogurt, you have dahi, you have soya milk, you have miso, you have temp, you have tofu, soya nuts, soya bean sprouts, soya flour, everything you can talk of is available today as a soya protein concentrate. And again, you can use it if you find cooking the soya a difficult task at home. More and more foods are coming up: soya butter, soya pudding, candy bars, soya ice cream, soya paste. So many are coming up that, well, it is constantly being developed. It's nice to incorporate something, buy soya nuts which are roasted, which are actually soaked, then roasted and made more digestible. Those are an easy snack to take and a very good snack to take when the day is a very busy day. Soya oil also is used in many preparations, which we know. Coming to tea, I've spoken about green tea, but I'm coming back to tea now. Green tea, the early shoots, when you go to a tea factory, you'll see that they are the ones which have 60 to 80% catechins. However, now why do people say green tea? I'm telling you here. Green tea has more catechins than black tea. The reason is that black tea is fermented and this is lost, some bit of catechins are lost in processing. So that is the reason when you may say that instead of taking so many cups of tea, which is a black tea or a oolong tea, you can replace it with 1 or 2 cups of green tea. Amongst tea, there is something called as white tea. Now we Indians want look at the color of the tea and we choose the tea. If it is nice and red, we say achhi chai hai. So here is where we don't know much of white tea. Now white tea has the highest concentrations of catechins, followed by green tea, oolong tea, and lastly black tea. These have high biological activity in the prevention and treatment of various forms of cancer. Shiva, you have to tell me when I'm running out of time, okay?
Ma'am, please continue.
Yeah, okay, thank you. So nuts. Now coming to nuts, I'm just not really going to discuss much, but few walnuts and few almonds per day are going to give you omega-3 fatty acids, are going to give you vitamin E. Peanuts, there is a big thing. Some dietitians may say don't eat peanuts. It's not like that. You can eat the peanuts because they offer you folate. Okay, so have everything in moderation. and have the right manner. Again, raw peanuts will be difficult to digest. Have them roasted or cooked, they are easier to digest. So, omega 3 fatty acids and vitamin E, which is an antioxidant, uh, is to be taken. A diet rich in vitamin E is very, very essential for the elderly because it protects them against Alzheimer's disease. And therefore, include almonds and walnuts in whatever form. They may not be able to eat, crush the uh, nuts completely, make a powder, incorporate it in some other days, but give it to them. Because in aging, you'll find that a lot of changes are taking place, and make sure that no senility is going to set in for anybody. Whole grains. A whole grain after milling will not have bran and germ, which has a large part of nutritive value of the grain. And therefore, whole grains are advised to be taken compared to refined cereals. Now, refining or milling removes the dietary fiber, iron, and many other B vitamins. So now they are fortifying these grains, okay, refined grains. But even if they fortify, which is not only going to increase the cost of these foods, what happens is that the original fiber content can never be obtained. In the whole grains, I'm not mentioned over here, but our millets are equally important. And eat, either it is going to be wheat. Now, somebody who is on a gluten free diet cannot say that I cannot take whole grains. You can take whole millets because they offer you the same benefits. Yogurt, well, we know the importance of yogurts. They are probiotics, they offer a favorable physiological effect. The benefits are in the lactic acid producing bacteria, and specific benefits are seen for lactose intolerance, constipation, diarrhea, colon cancer, IBD, H. pylori infection, peptic ulcer, and certain allergies too. Again, for yogurt, we did not have a recommendation, but it had said daily. So when we say probiotic, you take daily. A little bit for spices. Again, so many of our spices are very good in antioxidants. We cannot cover all. But turmeric, and I will talk of turmeric today because in the pandemic, everybody was consuming turmeric as though it is the only thing which is going to give them immunity from COVID. Okay, which is not right because it has certain side effects too if you're taking too many of them. So, curcumin is the bioactive compound. It exhibits therapeutic potential for Alzheimer's disease, Parkinson's, multiple sclerosis, epilepsy, allergy, CVD, and arthritis. So many, obesity, depression, fatigue, and diabetes, of course, so many of them. It is suggested that turmeric consumption may reduce the risk of some form of diabetes. But how do you consume? We all take turmeric in our diet, okay? We add it in our cooking, which is good. It will offer it the benefits to us. But remember, adding 1 or 2 grams of pepper will enhance the absorption of curcumin. So, when you're using turmeric, try to use crushed peppers and make sure that it helps you to absorb more curcumin. Now, what I wanted to talk about COVID, COVID, they were talking of, everybody was talking of turmeric. And of course, we know that turmeric latte has become a craze. And of course, our own native haldi ka doodh is gone and may become a latte for somebody else. But there are side effects because taken too much, it may cause hypoglycemia, and it is an anticoagulant. So it will slow blood clotting. Suppose somebody is taking the medications which are thinning the blood, they will enhance the chances of bleeding, and that is a problem because of which take turmeric in moderation and in the right manner. Do not make a craze out of it for immunity. Cinnamon has antibacterial properties, and it is said to be beneficial for many disorders and also enhances the immune system. One of the major benefits I want to speak about over here is for weight loss. It says you take cinnamon, which is true to a certain extent. But we do not have many scientific studies to support every claim for this. Now, methyl hydroxyalcone, a polyphenol compound, definitely helps weight loss. But again, going back Just taking cinnamon powder is not going to help you weight loss unless you plan your diet and work on it and do a lot of exercise, so that it will help you then reduce the weight. Secondly, cinnamon everybody doesn't like. Actually, it has a very sweet taste when you see eat it. It is slightly pungent initially, and then it is sweet. But people don't like it, so you cannot really force them to take cinnamon powder just because it is going to help them lose weight. Flax seeds, a functional food because it has the main bioactive compounds alpha linoleic acid, lignans, and fiber. They have cardiovascular benefits, and so they are popular. They are also popular because today everybody feels अलसी ले लो, सब कुछ अच्छा हो जाएगा, कोई चिंता करने की जरूरत नहीं है. But what you know is
I
that, Shiva, have I finished my
yeah.
time? Hello?
Yeah, ma'am. 2 more minutes, please.
Oh my God, let me just brush up
Ma'am,
quickly.
two
I'll
more.
skip some time. I have to go to some new important slides. Very sorry. Okay. So flax seeds, what I was talking was they can become rancid. Now let me come to the main important side over here, the opportunities and challenges. Regulations, labeling, formulations, and market competition are challenges. But the opportunities are demographics. Functional foods can be used from infants to the old age. They can you be used in every possible chronic disease and all lifestyle diseases. So the opportunities are immense. Specific challenges I'm not going to speak for, but there are few problems like isoflavones, which may be bitter, have poor solubility in water. So we can't talk of using isoflavones everywhere. Uh, Cooking changes definitely changes the bioavailability of compounds, and also each individual reacts differently to any functional food which we may give, is a very important factor to remember. Concerns: nutraceuticals are expensive, and consuming a lot of functional foods for the antioxidants such as wine or chocolate might aggravate other health problems. So be very, very cautious. Ginkgo biloba, I will not say it is similar like a blood thinner. So we'll not say. Coming to, so with the growing popularity of functional foods, it is not impossible to get a product like this, which is talking of putting a flavonoid with addition with the organosulfur compounds for added benefits. But remember, fresh foods and traditional foods have more functional bioactive compounds to offer. Consult a qualified dietitian, and thank you.